So technology has changed how my patients take care of their health and how I take care of my patients. So everything from sleep to oxygen intake can be tracked and helps you change lifestyle behaviors on a real-time manner. Finally, we have this tool that can actually help take care of my heart failure patients. Heart failure incidence is rising, and there's at least a predicted 46% rise in heart failure rates by 2030. And the problem with heart failure is that it's very expensive, and not just expensive, it's an incremental expense because at least 25% of these patients have recurrent hospitalizations within 30 days. So you're adding on to the expense of the healthcare system. So what this tool is a tool that is a composite index that helps me predict heart failure events in patients way before, weeks before it can actually happen. So I can be proactive in taking care of these patients and prevent that heart failure hospitalization. The HeartLogic tool is a composite index that's monitored over time. So there are multiple sensors that track physiologic parameters such as the heart sounds, the heart rate, the thoracic impedance, respiratory rate, and sleep patterns, and incline, and things of that sort. And these trends are monitored over time, and they are all combined into this index. And this index is the diagnostic tool called HeartLogic. Once this index crosses a certain threshold, which is truly programmable and is set by the physician, then the physician gets a proactive alert. And at that point, I get a list, or I get a chart of all these sensor trends, and helps me take care of the patient. When a patient has a heart failure event, they're already in the hospital, and we're trying so hard to take care of them and keep them out of the hospital. I think this tool is going to help me get this data weeks before and help me be more proactive with this patient's care and keep them out of the hospital, making sure that this heart failure doesn't get worse and they're not back in the hospital. I have actually started using implantable cardiac defibrillators and CRTDs that have the HeartLogic diagnostic tool in almost all of my heart failure patients, because I think it is a standard. It will become a standard of care, because we want to identify these patients, and we want to identify weeks before, way before they actually get worsening heart failure symptoms. Currently, we don't have any of that tool. So this is the only FDA-approved heart failure diagnostic tool that we have available right now.